I heard about laser pain cure in the Sunday paper. They had an advertisement, and I read it and called up for an appointment and talked to somebody, and that was it. No, never. The first time was at the seminar that I went to, and I was explained what exactly they do, where it started, and what is it that they can do for different types of problems with different people. And then they showed some pictures, and that really hit home because I knew a few people in my family that had similar problems. And I was even more interested and set up the appointment to start the treatments. I didn't know exactly, how everything worked, but it was explained very easily, just plain and simple language, and I just pretty much left it in their hands. It's a pretty long list. I have a prosthetic implant. It's a titanium implant, and that goes from C2, which is right in the back of just below the brain, then all the way down to C7, which is right in between the shoulders. And I got that in 2010, and there's the two scars here. They put it inside my neck and built it around the vertebrae. And they removed a calcium deposit that was covering that distance, the C2 to the C7, and then they had to put that around it and use it to brace the inside of my neck. And I have osteoarthritis, rheumatoid arthritis, sciatica, and fibromyalgia. So I have like the complete set. Oh, it varied. It was usually between a 7 and an 8. Sometimes it was a 10. Just before I first heard about laser pain care, I couldn't sleep right. I couldn't lay down. I had a heat pad on my back, and I had a hard time breathing. I just couldn't just catch my breath just in a laying position. So then I sat up in a chair, and that's how I went to sleep. And then the only thing that my doctor said was to double up on medication, the medication that I had, and it was pretty strong medication that I took in the first place, and that really didn't even help much, and I didn't want to go past the double the amount like he said. The pain really affected my quality of life. I couldn't dress like a normal person. I had a hard time putting my pants on, socks on, things like that. I couldn't squat, I couldn't bend over, and I needed help to sit down and I needed help to stand up. My second time. It was my second visit, and they did my shoulder and arm and down my neck, and then lower back. They did the full spine, and it was the sciatica that was really affecting it the most. And these were other problems that I had because I moved like a robot. It was just too tight and very robotic, and I had to turn everything with my shoulders. I couldn't even turn with my head or neck, and now I can move normal. I'm pain-free. There's no pain whatsoever. I had my medication prior to it, and I haven't had any medication in about 2 months. Haven't had a need for it, and the medication that I had was a little over $500 a month, and then my doctor suggested to go and double it up. He did some blood work and he said, well, maybe you should just double it up. So that's $1,000 a month, and I don't have to have any of it. Fantastic. Fantastic. I show my wife, I just pull her off to the side and say, here, look, you want to see me walk? And here, look at me. I could pick up my legs, and it's like, you know, it's almost as if I'm like a kid showing, you know, hey, look at me, but that's the way I feel, you know, because, you know, I always say, you know, the way I used to be, you know, and I speak of it like it's such a long past, but it's really, it was, you know, it was only 2 months ago when I started, and it just feels like that was so far and back of me, you know. To anybody who has ever had any pain like mine, similar to mine, you know, maybe they have a different type of pain that I didn't have, but they should definitely look into it, absolutely.